Welcome to our second session. This time we have a bit more specific subject. Last time, as you recall, was more an overview. Those who attended, CAT Plus, consisting of Top Bar, the clinical audit tool, or CAT 4 as it is now, and PATCAT, which we didn't really touch on because PATCAT is mainly used by the PHN, an aggregation tool for de-identified data. So today we're going to look at CAT 4 and Top Bar, the tools that you have in your clinics, and in particular how to use these tools for data cleansing in regards to general data quality, but more specifically around accreditation as well. Yeah, as I'm sure you're all aware, the accreditation guidelines, they actually do talk quite a bit about what should be in a patient's record, and how it should be entered in there. So if I have to show you anything in the clinical system, as last time, I'm using Medical Director 3. For those who are using best practice or other systems, my apologies, but I can't run both at the same time, and the things are normally quite similar across the systems. So let's have a look at some of the basic things. And really with CAT, and as you recall, I hope, there's all the filters available, so you can actually pretty much any example I give you, you could refine that further by using additional filters. But what we're going to start with is just looking at some pre-configured, pre-existing reports where you don't actually need any filters, at least not necessarily, and that will tell you about the data quality at your clinic, and also allows you to get an idea if you need to clean your data, what are the areas that need particular attention, where are things going well and where not so. So with this introduction, first one here is the data quality tab. Yeah, by the way, from when you start CAT and you're on the dashboard, which somehow is coming up, oh, here we go. So starting from here after logon, I have gone into the CAT 4, the full range of tools, and I will stay there today. But these, like particularly the cleansing view, is obviously something that is specifically around cleaning data, and I'll show you that you can access everything from CAT 4 from this view anyway. So we're back there. Data quality tab. Now we do get quite often people asking about this because they're not quite clear about this particular tab, this particular report. It's very vague. Yeah, what does it actually mean? And the idea of this report, and this was created in the run-up of the PCHR back then, the My eHealth Record Now, or My Health Record Now, the way it was specified to create, so this came from NITA, and I think together with the RCGP. So they basically try to incorporate the accreditation guidelines together with what they think, or probably still think, at least thought back then, would be useful in the shared eHealth record. And so this is what came out of that. So we have a number of big headings: allergies and adverse reactions, medicines, medical history, health risk factors, and so on. So these things, and they just get a color, traffic light idea, green is good, orange is okay, so, and red is an area in which this particular practice in my example does not perform very well. And then you get a percentage here, so which, from this screen, not very clear what it actually means. What you can do, you can click on that view guidelines, which will get you straight away to the RCGP website and their the general practice fact sheets about medical history, and it just tells you basically their standards, what the scope, the rationale, and so on. But really, what we want to look at to get further information on this is the next tab, the data completeness report. Yeah, so the dashboard is really only to get you an idea where are the areas you're doing all right or not so good, and then the completeness report actually shows you the details in there. So the same headings, allergies and adverse reactions, for example, and you can see this is pre-filtering the data. Even though my clinic here has more than 8,000 patients, there's only 4,977 in the eligible population. And these are people with at least 3 visits in the last 2 years. Yeah, so the accreditation guidelines definition of an active patient. And you can see my clinic here has, out of those patients, 95.5% do have an allergy status recorded, which is quite well. There's not that many that haven't anything recorded in there. You can also see the coded format is not available out of Medical Director. I think it is in best practice. It might be in some of the other smaller systems as well, but in MD that is not an available field. Most of them are in MD and best practice and ZMed, but there's always some where the systems slightly differ. The third one here is allergy recorded and a reaction completed. So that's an area where they're not doing so well. So we have more than 2,000 people that do have a allergy. We don't know what particular allergy it is, but just something recorded in there. But only about half of them actually have a reaction recorded. So that's something where it would also be useful to have that actually in there, because it might be a rash, it might be a much more serious reaction. So when you think about sharing a record electronically, it's great to know that person has an allergy against whatever particular medication or whatever it is, but to add the particular reaction for that allergy would make the information even more useful if that's received by, say, an emergency department or someone who doesn't know the patient and relies solely on the shared information in the record. Yeah, and the number at the front, if you go back to the dashboard under the allergies, you see the 72.94. That's purely a calculation out of those two percentages together. Now, that was, just to remind you here, the medicines was in red, only 25%, and this shows you why. So we have 13,064 medications prescribed. Out of those, only 3,307, or 25%, have a reason for prescribing coded in the system. And again, I guess that's another extra bit of information. Yeah, it's good to know what particular prescription the patient is on, but to have a coded reason in there, it makes it more useful for someone else who looks at the record, of course, as well. And I'm not sure if this is a representative value, the 25%, or if that's something that happens across the board. Have a look at your data after the session, and you will see how you're doing in all of these areas. Now, scrolling further down, we have things like medical history. So they have more than 40,000 diagnoses or whatever it is, issues recorded in the patient history. More than 88% of those are coded. So that's pretty good, because this doesn't take into account when that diagnosis was entered. Maybe 10 years ago, there was a lot more free text. But this clinic, I'd say, is definitely doing quite well in the coded format. Again, have a look at yours, how that compares. And further down, there are the things that are additionally recommended to have in a patient's record, such as smoking status, waist circumference, alcohol status, immunizations recorded. Now, this one here, it doesn't mean they're up to date with their immunizations. When you look at the guidelines, the accreditation guidelines, they say a patient's record should have information recorded about immunizations. It doesn't specify which ones. It doesn't say they have to be up to date and so on, which is hopefully implied anyway. But what we measure in this, and this is strictly to meet these accreditation guidelines, and we say, is there any information in the patient record that relates to immunizations? Could be an old one, not up to date, but as long as there is at least one immunization recorded, then we count that as a tick, and that's why the 65% or nearly 66% comes up here. And then there's a bit more in here, things around social history, ethnicity, carer, occupation, and so on. That's hopefully pretty straightforward. Now, so you can look at that overall, as you've done with the first one here, to see which areas. You can look at it here in more detail. But what you can also do now is employ the filters to make this a bit more relevant or meaningful. One example, of course, would be looking at visits. Maybe you know that there was issues in the past, but since whatever in the last 2 years, this clinic has really cleaned up their act, and they've entered only coded diagnosis. They enter reason for prescribing, all of that. So you could apply the filter for the last 24 months only, and look at it now, and you can see that population is still the same, because all of these people have visited in the last 2 years. Remember, the definition is 3 visits in the last 2 years. And then you can see the numbers in here, and that would tell you. We could also look at the dashboard. Is there any change in here? Probably not much change, but it's just an example. You could, of course, choose a much shorter date range, only in the last 6 months. So just for the person who just dialed in, you are on mute. I hope you can see the screen. If not, I'm not sure how you can tell me. You can type into the message board in here if you have a question, or you can press *7 and that will unmute your phone. So if you have technical problems or any questions, *7 will unmute your phone and you can ask. So when you apply a shorter period, like the last 6 months only, that will have an impact on here. So you could see population numbers have gone down, and you will see changes in the percentages as well. So that's one example for filter, but the really interesting one is when you filter by providers. And I'm pretty sure I mentioned that last time. We assign providers, depending on the clinical system. If you're using Medical Director, we purely base that on which provider had the most contacts over the last 18 months. So if you have multiple doctors at the clinic, the patients come in and see several of them. Whoever was seen most over the last 18 months is the assigned provider, with the idea behind that the person who sees the patient most is also the one who enters most of the information in the record, and that makes sense in that context. With best practice, it's different because best practice has a field where you can actually enter the regular doctor or the normal doctor for the patient. If you have entered a doctor's name in there, we take that. If it's empty, we do the same calculation as I just explained, most contacts over the last 18 months. So if you wanted to filter by a particular doctor to look at this report, that would give you now, in this case, 507 patients that had 3 visits to the clinic and are assigned to my selected provider. And you can see now how the dashboard, for example, looks. So we don't have anything green on there, for example. So this doctor is probably not the best in the medical history, was the green one, but not far off either. So that's certainly a way to, for a practice manager or for the whole team, to just have a look at what's going on, which areas in the patient's record are, say, the best, where does the clinic do really well, and where it might not be worth to spend extra effort on getting things done, and find the areas where there's most data missing, which is overlooked. Maybe you find out that out of 10 doctors, there's one person who always free texts the diagnosis, and that's something that hopefully can be addressed. And that might improve overall the records in the clinic, because you found the one person that's been putting in information that we couldn't analyze. So that's a way to use the filters, as I said before, to refine to your specific interests, or any other things really. I've used just the 2 examples here, so the last visit period and the providers, but you can use any other filters as well. If you wanted to know, are patients with diabetes more up to date than others, you can use the filters to find that as well. So that's an overview, as in who's actually or what's actually missing, how are the numbers at the clinic. If you wanted to get into rather than, and there's a bit more in here, there's graphs as well. The graphs allow you to pull out the patients by double clicking, like any other CAT graph. So if you wanted to find the say the 224 people here with an allergy status missing, or the 154 smokers older than 10, where there's no cigarettes per day entered, then you could just double click on there and that will come up with their details. So you got the 154 people there. It also shows you the other things in a bit of a shorthand, what else is in the record and what isn't. But because we selected the not recorded cigarettes per day, that's the 154 people with that particular item missing. The other report, just while we're here, I'll just try to unselect. This is a bit tricky. Let's see if I can do it from here. No. You can always click on the legend. In this case, it first selects all, and now they're all unselected. That's all I wanted. This one here will give you duplicate patients, and there's 2 headings there. Duplicate numbers, so where we're looking at Medicare number, healthcare card number, DVA number, and I think also the ID, the internal ID will be checked, but that shouldn't be possible to have duplicates there. But it certainly, with my patients, they all have the same Medicare number, so they all come up as duplicates under the number report. And under the duplicate name report, because mine all have the same surname and their first name starts with first name, they all come up as duplicates as well. In your case, that's where, see, these are the things that we're looking at: the surname, first name, initial, gender, and date of birth. If that is duplicate, then they will show up as a potential duplicate. One example that we often get in this context is people say, well, we have twins in our practice. They got the same date of birth, the same surname, and they may be called Jack and John. So their first name initial is identical as well. And in this case, they will be listed as duplicates. It doesn't mean they are, so we just show what looks suspiciously like a duplicate. It does not mean you have to get them all off the list, but it will find people that have the same surname, initial, first name, gender, and date of birth, and in the number report, Medicare number, healthcare, and DVA. So those three will be checked. That's the duplicates in there. And I think I probably showed you the data cleansing last time in the context of top bar, and I'll just repeat that because this is really where the two tools are working together. I guess that it comes already in with the data quality tab as well, but the data cleansing report is different, and remember from the dashboard we have actually the cleansing view as well. If you jump here, it's exactly the same, but all the other reports at the top have gone because we're only in the sub item in the cleansing cat. From here you can also go to data cleansing, you have it available as well. So missing demographics, you can see a list of names, and that's what I said before. This is different from all the other reports in CAT where we normally get graphs and like say the allergy status, and to get the names you double click on there and you get the patient details. In the cleansing report, we only list the names, and we list only those names of patients that have something missing, at least one of the items. So you can see we've got people with date of birth missing and with a gender missing in here, and that's why they're coming up in the demographic one. This button here, the show and hide columns, you can see there's a bit more. You can pick additional fields to add to this report. So if we say we also want to include ethnicity status, suddenly the number's gone from 7 to 2,259. So again, one of the things that I have to repeat always, and it's important to understand, CAT is a population tool. It will not, you don't have access to these 2,259 people. You don't know the ethnicity by looking at the names, or you don't know the date of birth when they're not present. So all that CAT can do in this context of data cleansing is show you how big the problem exists, or if there's a problem at all, and if there is one, how many patients are actually affected by it. But this is also where top bar comes in. So as a practice manager, for example, if you look at your population in your clinic and you find out, okay, either using the data quality, it could be the dashboard, it could be the cleansing report, you find out where the issues are. And if you're using top bar as well, which I think most of you are, or at least several, then that's where the waiting room and the cleansing app both come in. So if you look at the demographic tab in top bar, and you see my favorite patient here, Maureen, she has quite a bit missing there in her record: the gender, contact number, next of kin, Medicare number, ethnicity, all of that's missing. These things are there. These lists, the action required and the completed, relates directly to what we have on the demographic column in here. That's exactly what we check in CAT for everyone at your clinic, or a subgroup because you've used the filter. And in top bar we prompt or notify about the same items missing when people present, either through the waiting room app when they're in the waiting room, like my 3 people here with action required and the other 2 that are completed, or if the patient then gets called into the consult room and it's actually opened up in your clinical system, as I'm doing now with Maureen, then the cleansing app will do exactly the same as the waiting room app, but now just for the one patient. So again, under the demographic tab, you can see these items that are missing for this patient, and that corresponds, of course, to the demographic and also the clinical tab in here. So again, basic information such as allergy status, height, weight, alcohol, smoking, and so on. And also, if you're interested in more or in others, and you can remove, you can say, well, we've done all the allergy studies. We don't want to do height and weights, but we want to make sure the diagnosis is coded, and these are the only ones that we're interested in. So that will show you there's 1,588 patients in my case that have that don't have a coded diagnosis in there. Don't forget, you can filter. So for example, if we use the active filter, that has just gone down from 1588 to 431. Yeah, so big difference. And again, that makes sense. The people that have not visited in the last 2 years, they might have come years and years ago. Maybe back then the practice wasn't as diligent and they put a lot more free text in. So now we still have people with free text diagnosis, but yeah, so sorry, when I say free text, this means these 431 patients do not have a coded diagnosis. So whatever is in the record, it's either empty or it's only free text. As soon as there's one coded diagnosis, they get a tick. We don't say they have to have everything coded. It is purely about at least something coded in there. If there's nothing at all, that's when we show them. There's a question. Keep the patient in top bar when the GP is up in the patient. Sorry, maybe can you press *7 because I'm not quite sure what you mean with the question. So *7 on your phone and I can hear you. Not working. I've got you there under Collinsville. I can probably try to unmute you. Just give me a sec. Hello, Collinsville? Yes, I can. Correct. It will only show in the waiting room app when the status of the patient is in waiting or possibly in billing. But when they're in consult, they won't show in the waiting room app. Yes, if they instead of just leaving, if they put them into the status billing, then they will show again. Yeah, so the reason being that if a patient is seen by the GP when they're in consult, then obviously they're not outside to talk to the receptionist or someone else and they can't really do anything. But if their status is waiting, so they have arrived and they're in the waiting room, or they've come out of the consult room and they're waiting for the billing, then the waiting room app will apply and kick in. If the nurse opens up the chart and uses top bar, then all the information that's on the waiting room will show in the cleansing app for the nurse. Yeah, I hope that answered the Collinsville question as well. Okay, great, fantastic. All right, so where was I? Let me see. Yeah, so the filters I applied there just by looking at active patients only. That has changed quite a bit. And so would, of course, the other filters, again, by provider, for example, or by certain conditions. Any of the filters will work on this. Just while we're there, I had someone calling about a different issue not that long ago, and I just thought I mention this today. If you wanted to find people with chronic conditions or with multiple chronic conditions, this is not the way to do it. You cannot click diabetes, yes, respiratory, yes, cardiovascular, and whatever. This will only bring up patients that have all of the selected conditions. So at least one type of diabetes, at least one type of respiratory, at least one type of cardiovascular, and so on. And you end up with very little patients there because there's just not that many. So this does not allow you to search and do an OR search. There is a way potentially in here, but not, the pneumococcal doesn't really go for everything. So to combine multiple chronic conditions with the cleansing cat is currently not possible. That you can say, yeah, I only want people with any chronic problem, and how good or bad is their clinical record status, how complete are they. You can't do that right now. But you can combine things in other ways, which I'll probably show you in one of the next sessions, not today. So that was these two items in here, and as I said, either through the waiting room app, where you can see people that are waiting. It's actually interesting because in my scenario here, I've got Maureen open. Oh, you know why? Because I haven't changed it. That's why. She's still waiting in my Praxsoft system, but if you run the practice as you should properly, then of course Maureen wouldn't be on the waiting list anymore. So I still have her on waiting room as well, but it would work with any of them. So you have the demographic and clinical tab that show you the same information that the cleansing app shows you under the demographic and clinical tab. The difference is only cleansing app works for the patient open in the clinical system. Waiting room app works for anyone status arrived or waiting or in billing, depending on the different systems, what it's called. But basically anyone who is physically present in the clinic but not in the consult room. And of course, as everything, it depends on the diligency of the person, say at reception. If they don't change the status when someone moves into the consult room, then we don't know. So if everyone kind of updates the clinical system as they go along, then that is reflected in top bar. And this tab here, we talked about last time, the indicated chronic problems, diabetes, mental health, COPD, or kidney disease on the individual patient will be displayed in top bar, whereas in CAT, again, this is what I said before, this will give you an idea how big a problem this could actually be. And I think that's actually a really good starting point. If you say you have an absolute love for complete data, for data quality, you would love to have your system completely correct and up to date, and you sit down with you looking at these reports in CAT. Okay, hello. Hang on. I'll just go to, I don't know who that is, but let me just put the details in. This must be someone who joined later. Yeah, these reports, I should say, the chronic kidney disease, indicated diabetes, indicated mental health, and indicated COPD, they will give you an idea how big a problem we actually have. Now, is it maybe 2 or 3 people where we think they have this particular problem based on their pathology results or others? Or are we looking at quite a few, like this clinic here with 125 people with indicated diabetes? Don't forget, this is very likely not the total amount. It's very unlikely that we get it 100% right. So if you think, you know, the numbers are a bit scary, there's definitely, there will be false positives in that context, that we think someone has diabetes because of their medication or their results, but on closer examination they actually don't have the particular problem. But in other cases like the COPD, for example, even though the numbers are not that high here with the 17, you can see the medication tiotropium is quite specific, and that is picked up. So these should really only be people with the particular problem. Hi to the person who just dialed in. We've put everyone on mute. So if you want to ask a question, you can either type like you did before or press *7 that will unmute your microphone. Yeah, so again, what you can do in here, either you can filter, or if you look at this column here, the assigned provider, you could sort by clicking on there. And that will give you also an idea of which of your doctors has most of, in this case, patients with indicated COPD. So maybe you see out of 5 doctors, there's only 1 that shows up, and maybe it's because this particular person is using free text or is not putting a diagnosis in at all for some reason. Again, like I said, CAT is the tool to find out how big a problem it is and possibly also who is contributing to the problem. What you can't do from here is solve the problem instantly, because For one, the patient isn't here. Secondly, if you are not a clinician, if you're just looking at CAT for reporting for the clinic, you certainly aren't in the position to put a new diagnosis in or correct an existing one. So these four, kidney disease, diabetes, mental health, and COPD, they need to go back to the doctors to review, possibly find an old diagnosis or referral letter, whatever it is. But that's something where to find the size of the problem is actually quite easy, but to fix it, unfortunately, is not. So that takes quite a bit of work. And again, you can use filters to make that more relevant or narrow the numbers down by using, we already have narrowed it down to the active patients, but you could also say, well, we're only interested in those people that have visited more recently or any other criteria really. But that's the cleansing CAT reports in there. So I won't expect people to go, oh, fantastic, yeah, we have 125 people possibly with diabetes. We're going to fix that up in a week. It does take time. Don't think that's all only because you've got the details there doesn't mean it can be fixed quickly. Just on that, you can sort, and the colors are indicating the likelihood. The yellow is the least likely, orange is sort of likely, and the red is the highest likelihood that this person actually does have diabetes. And with the others similar. You can see with the mental health we have an orange and a red category. So to have that mental health plan item claimed is a higher probability than just taking a mental health medication. And you can see there's other things that are indicated like diabetes, COPD, and so on. So if you're saying, well, we're interested in patients with diabetes who possibly also have a mental health problem, then it's interesting, there's just a yes in here, so that's probably the undefined, where we don't know if it's type 2 or type 1. But you can see by sorting, you can get that out as well. And of course, exporting into Excel will allow you to then do your own sorting or create extra columns and so on. You can do that with all of the reports. So these are two predefined reports that allow you to identify where the main problems are, go into more details as in looking at percentages and narrow it down possibly to individual providers, or going to the data cleansing, actually identify the patients where we can see that there's data items missing or potentially free text diagnosis or no diagnosis at all for a chronic problem. If you find that a patient does not have a particular problem, the tick box here, the confirmed condition does not exist, and then save and remove, will take this person off the list in here and will add them to the reviewed list. So this is the one, several in here. And you can see that it shows who's been removed in the clinical order tool and also who has been removed in top bar. And that will really be quite useful over time, because you can see are people using top bar. The button or the option in here is the equivalent. Confirm indicator condition does not exist. So they talk to each other. If you remove someone in CAT from that indicated condition list, they will not be prompted in top bar either. I guess that, again, coming to when can you actually fix this problem, as people present to the clinic, and if the doctors are looking at this particular tab in top bar, that's really where hopefully the action will come from, because that's when the patient is there. They can talk to them, they have their record open anyway, and they can fix it on the spot. Much easier than working with big lists and trying to get someone to actually open up every patient's chart and review and then fix up the diagnosis. So that's the data cleansing reports in here. Now, I just wanted to show you a little bit more custom things, because you can actually do cleansing as well by using CAT filters for a couple of other things. One that comes to mind just easy on top here, you can find people with a missing gender by just clicking on other and run the filter. You can find people with a missing date of birth by doing that in here. Both of these are actually in the cleansing app under the demographics. We have the date of birth, we have the gender in there, but some people prefer to work with the filters. You can also go in, and this is specific to diabetes, so you can clean up your registers by clicking type 2 and type 1. You get a well, not many of them, but 5 people that have type 2 and a type 1 diagnosis, yeah, which shouldn't be the case. So when you work with a filter and you do not actually need a specific report, I just showed you this disease report to see the numbers, but all you want in this example is a list of all patients with a type 2 and a type 1 diagnosis. Apply the filter, click on view population, and that will give you those 5 people. So that's the 5. This doesn't count individuals, it counts diagnoses or history items. And we can see from here on the top it will say type 1 yes and type 2 yes, and you will also see who's their last provider and when were they last seen. Yeah, so if your clinic decides to clean up the diabetes register, to get rid of dual diagnosis, for example, like this one, that would be an easy task to do that, and you can sort. And in this case, you can see that quite suspiciously, 4 out of the 5 is the same provider, surname underscore 13. This is just the identified one, but that's where you think, okay, maybe we need to talk to this particular doctor. So that's an example, type 2, type 1. The other one is the undefined diabetes. I'm pretty sure I mentioned that last time. Anyone that's been diagnosed with diabetes but not a clear type 2 or type 1 will be mapped back to the undefined. And while it's not a huge drama, and at least it's a coded diagnosis, it's still nicer for your internal reporting. It's better for your quality of your records of the patients to have specified is it type 2 or type 1. And these undefined ones, you can see there's 8 of them. And if we click view population, these are the 8. And you can also see the providers and when they last visited. Now with these, with the undefined diabetes, that's actually an example where you can work with lists, even if you have a large list, because maybe historically your doctors just picked diabetes from the coded diagnosis and never put in type 2 or type 1. If you create this list and you take it to the doctors, I would be fairly certain, particularly if it's patients that have visited recently or frequently, that they can go through the list and say, yep, type 1, type 2, type 2, type 2, and they can provide basically instructions, or that they guide someone else, not themselves, to fix up the patient record. And from what I've been told, that is actually medically legally acceptable, that a nurse, someone else with clinical access, can, under the doctor's instructions, go into a patient record and, in this case, change an undefined diabetes diagnosis to the correct one. So that's something where, again, the teamwork, the sharing works out well, because you probably find it hard, particularly if they have a large list of these undefined diabetics, in this case, to get the doctors to sit down and go through every patient. But if you can, for one, break it down by the individual doctors, that might help. But also, if you then say this can be actually delegated, if the doctors are happy with that, and they probably are, and they can give you the instructions, which one's type 2, which one's type 1. They're probably not on top of their head. There's just not that many type 1s around, and that can be fixed. And in the next data collection in CAT, you might have 0 undefined diabetics or very few. So that's an example using the filters directly to fix up, in this case, a diabetes registry. Now that's probably most of it from me, or if not all. I'll unmute you and happy for any questions, or if you have a specific example you would like me to show you, whatever you want to do. So you're all back online. Anything? No questions? All right, well, if there are no further questions, I thank you for your time and for dialing in. And I will record this session and